And basically what it is that you have to get approval from the legislature to get to build a new medical facility in that specific state. So there's like 36 states that have con laws.
Does Texas have one?
And I believe Texas has one.
They got to get rid of that shit.
They got to get rid of it. I mean, it is the most anti-free market,
it
thing ever.
People to be dependent on the healthcare system.
Yeah, and it forces or it allows these big hospital systems
to exploit it.
Exploit it.
Andy, we're rolling, right? All right, glad to have you back.
Thanks for having me. I feel like I'm in front of a celebrity now.
No, dude, I'm a two-hit wonder, I guess, right? I'm an influencer now. I'm a big deal, all right? I'm a viral sensation.
I just wish I could be a viral sensation someday.
Well,
maybe this podcast will do it.
Maybe you get to provide this viral sensation with healthcare.
There you go.
With affordable healthcare at a reasonable cost.
I will.
That's independent of the corporate healthcare apparatus.
Yeah, exactly. Away from the system. Exit the system, folks.
And so your name is you're Andy Schoonover.
Yeah.
And you are the CEO of Crowd Health. You were back on this podcast a little over a year ago, but just to reiterate, tell everybody what Crowd Health is.
Yeah, we're an alternative to health insurance. So people who think they're getting screwed by their health insurance, which if you do have health insurance, you probably are. We're for those folks. We're the folks who want to exit that system, exit the medical industrial complex, and relieve yourself of the middleman between you and your doctor.
Okay.
So, if you get hurt, we've got a community we have almost 10,000 people who signed up so far, who will help you out in the event of an emergency and take care of you. So I think we've gone through about 20,000 bills to date. And 99.8% of them have gotten funded. So it's a hell of a lot better than what health insurance has done.
Remarkable. How does that work?
Yeah, so it's $50 a month in administrative fees. That comes to us, and then we'll ask you for an additional $135 a month to help somebody out. You were asked today, by the way. I don't know if you know that.
I saw that.
Yeah, you were asked today. And that money goes to somebody else in the community. Do you remember what you were asked for?
It was like $130. I don't know. I don't even look at it because it gets...
I think it was a pregnancy. You're helping somebody out with their pregnancy.
Well, that's amazing.
Yeah.
That's how it should, yeah.
So money is going directly from your account to the person who is pregnant so that they can pay their bills. And after we ask, 20 or 30 people for whatever that amount that she needed was, then she has enough money in her account to then go and pay for her pregnancy.
Yes.
And so the cool part of this is she's paying in cash, not with health insurance, and therefore getting significantly better rates from doctors and hospitals than even health insurance companies. So you and I, as individuals, can actually negotiate better with health insurance companies and hospitals and doctors better than United Healthcare, which is the 7th largest company in the planet.
Because the healthcare companies always take a cut when you go through the health insurance, and the doctors have to charge a higher rate.
And it's wickedly bureaucratic.
Yeah.
So doctors spend about a day a week.
There was a South Park episode about this, navigating the American healthcare system, and it
was
turned into
awesome.
A giant maze. It was hilarious.
It was hilarious. Go watch it if you haven't seen it. Doctors spend about a day a week on fighting with health insurance companies. So imagine, for those listening, if the way that you paid actually sucked out 20% of your time, how expensive that is, right? If I show up with a credit card and say, here, that's 2%. And so they're spending a lot of money on billing health insurance companies. So if you can rip out that middleman, you just save a ton of money.
Absolutely. And also when you're dealing with insurance, the doctors have an incentive to try to provide you with as many services as possible, whether or not you need those services, because insurance will cover them, and then it'll help pad the doctor's bottom line.
Exactly. Well, I always say that you work for whoever pays you. So who pays the doctors? Insurance companies. The doctors are actually working for insurance companies. They're not working for you. They're getting paid by insurance companies.
But what about the private hospital? Aren't they also getting paid by the private hospital? Because you brought that up too last time.
But ultimately, who's the end payer of that? It's insurance companies who are the end payer of that, right? And so in essence, what you have is you have the government, you have health insurance, and you have the hospital in between you and the doctor. With Crowd Health, you're paying the doctor directly. And so you can get back to that doctor-patient relationship, which is just hugely, valuable. I'll give you a quick scenario here, or a real story. Last year, about this time, I was having some pain in my chest. Fortunately, it was just a pinched nerve, but I went to the cardiologist, and I told the cardiologist, I said, hey, I'm cash pay. And he's like, oh, okay. So I need you to do a couple tests, but instead of you coming back to me, coming back into the office, since you're cash pay, can I just call you? I was like, hell yeah, you can call me. Like, the last thing I want to do is spend a couple hours in an office, in a medical office, right? And so he actually treated me differently, better, as a result of being cash pay, because these doctors want cash pay patients. They're tired of health insurance as much as you and I are.
Yeah, makes sense.
Yeah,
that makes sense. What about the capture of the hospitals, though? Because what I notice is, like, I live in a small town now, right? If I wanted to go to a doctor, I have to drive like 30 minutes to an hour to go see a doctor.
Okay.
And I think that's absurd if you live in a small town. Like, especially, what if you can't drive? What if you're like a senior citizen? What if you're an old lady? What if you're like somebody who? What if you're somebody who just can't even afford a car, and you have like a medical procedure, right? And you live in a small town, and then all of a sudden now an ambulance is take you an hour or 40 minutes to go to a hospital, and then that also runs up a ginormous bill. How do you circumvent it, and why are there so few doctors and smaller hospitals / medical facilities in small towns all across America? It just doesn't seem to make any sense.
Well, you ripped out the family doctor from those small towns. I mean, remember, you don't remember, but 50, 100 years ago in these agrarian towns, you had the town doctor. and with the kind of fiatization, if I can use that word, of healthcare, those family doctors, they can't make it work within those small agrarian towns anymore, and so they all moved to the big cities. So everybody's got to get their healthcare from larger cities. That's the issue. I would say on the other side of that, the virtual telehealth, I don't see doctors very often.
I don't either, because I'm healthy and I don't eat fiat food.
Exactly.
And I limit how much alcohol I drink. And
exactly.
And I don't smoke cigarettes. And I think generally if you leave a healthy lifestyle, you don't really, a lot of these medications and prescriptions and the care that they talk about on television isn't really applicable to you so long as you're healthy anyway. Yeah,
exactly. And virtual care has gotten a lot better over the last 4 or 5 years. I mean, COVID sucked. The one benefit, that's the only one I can think of this, is the virtual doctors are a lot better now, much more widespread, a lot more access to them than they were 3 or 4 years ago.
Well, there's also a good thing about COVID, too, and it's that alternative systems have gotten a lot more popular, and people are opting out of traditional systems.
People are questioning the system.
Which is good, which I think is a good thing.
Yeah, absolutely.
And just hopefully people question it with intelligence and not just believing every single conspiracy theory just like you believe everything on the news. And I think that's the problem that we're actually running into now.
Amen. Yeah, I agree with you.
Which is crazy because I'm like in the business of conspiracy theories, but like, it's like.
It was kind of funny hearing you say, "Oh, everybody's coming up with all these conspiracy theories," and here I am sitting next to conspiracy theorist number one.
Yeah, pretty well. I'm up there. Yeah, I'm a household name in the conspiracy theory community, and I'm like, dude, these even I'm saying that the conspiracy theories are going too far.
What about the conspiracy theory of Goldman Sachs came out with a research report? And basically what it said was that the question in the research report was, does it make a business sense to cure patients? That was the question. And it was towards pharma, right?
That's not a conspiracy theory. That they're just like saying the quiet part out loud that everybody's been talking about.
Yeah.
What I mean by conspiracy theories is like there's always an alarm to be sound about how they're going to cancel the election, like that type of stuff, right? Or like, oh my God, the Jews control everything. Look at how much I'm noticing. It's shit like that, right? Like that kind of is annoying. Or like, oh my God, look, they're going to come up with a new bird flu to bring in the mail-in votes, and they're gonna cheat and steal the election again. And like those types of conspiracy theories are just noise. It's like mainstream media filler bullshit, and that's what I mean by the conspiracy theories.
Yeah, no, I hear you.
That's not a conspiracy theory. That's an established fact.
That's an established fact.
Yeah, like that's kind of an established fact that everybody's been kind of that people have kind of known about and understood. And these used to be common talking points on the left. And because the political left has just been hijacked by big pharma and by big tech and Wall Street and the military-industrial complex. And by the way, like our healthcare system is almost an offshoot of the military-industrial complex.
It's an offshoot of the government too. It's a para-government. Yeah, no, I guess I was saying there's a fuzzy line here between facts
and
conspiracy theories. And I think there's, a lot of this stuff going on in healthcare when I say, hospitals actually, make more money when you're sick. Insurance companies make more money when you're sick. Pharma makes more money when you're sick. A couple of those are obvious. Like pharma, of course, they're giving you more drugs if you're sick. Now, does that lead them to not go after drugs that actually cure you? Is the fact that we don't have a cure for cancer yet a result of pharmaceutical companies knowing that if they do have a cure for cancer, that entire business line goes away? That's the conspiracy theory component, where it's hard to understand.
Not a conspiracy. That's like a legitimate. That's like a legitimate, real concern.
It's
right?
a concern for sure.
But the fact that the fact that people call that a conspiracy theory is kind of something that needs to be addressed.
A lot of times, it's just the intention behind it. Is that actually the reason why cancer drugs haven't gone beyond? It's impossible to know unless you are sitting in a pharmaceutical company. It could also be.
Here's the pushback too. It could also be that it prevents people from like selling snake oil for profit and saying this is a cancer drug, and like you got to go through testing and go through a bunch of steps to make sure you're actually curing cancer. So I mean, you do want to take all, like if I make a drug that says I'm going to cure cancer, you probably should go through a ton of bureaucratic steps to make sure that the drug actually works. The problem is the companies will micromanage and do a lot of things throughout that bureaucracy to kill this drug and stop it from being made through a lot of unnecessary means. But the steps to actually take those tests is a good thing. It's just a matter of what's happening during those steps, and maybe you can cut out a lot of the bullshit while those steps are being taken.
Well, and
if that makes sense.
Callie Means and RFK Jr. were talking, and one of them, I can't remember who it was, said that the FDA, 50% of their funding actually comes from pharmaceutical companies. So, and then the funny thing is FDA came out and said, no, it's not 50%, it's 47%. Like they literally made that press release. So 40% of the FDA's funding is from pharmaceutical companies. And then again, you work for whoever pays you. If almost 50% of your funding is coming from pharmaceutical companies, how does that impact your behavior?
Yeah.
How is there not...
But if a pharma company comes up with a drug to cure cancer, how much money would that company make?
It depends upon, is it for all cancer or is it for a specific,
Any cancer. Like you make a drug to cure cancer. Like to cure breast cancer, you're a multi-trillion-dollar company right off the bat.
Hundreds of billions for sure.
Yeah, if you're a shareholder in that company, you're benefiting exponentially by making a drug that cures cancer too. So I guess what I'm trying to say is that there's an incentive to keep people sick, but it's more about just it's not about losing money. It's about losing an income stream, because initially, if you make a drug to cure cancer, you're going to make way more money than whatever your income stream is.
Right.
It's just a matter of okay, well, how do you continue to generate that income stream?
Well, so
if that makes sense.
You talk about some of these drugs in which you have to take for the rest of your life, for statins, for example, right? Like these pharmaceutical companies want you to take statins because you have high cholesterol. They now have a very reasonable incentive to not have data come out that say, hey, guess what? High cholesterol doesn't actually cause heart attacks. Because that would wipe out an entire business line of a very, very profitable, maybe the most profitable drug ever in statins. And so there's got to be at least an acknowledgement of perverse incentives within the pharmaceutical industry that they don't want research to be published that offsets what, kind of existing research that eliminates the need for their drugs.
Absolutely, that makes sense.
Yeah.
That actually makes a lot of sense. And they did similar studies along those lines by demonizing fats and meat. And glorifying carbohydrates and downplaying the effects of sugar. And then a bunch of people got diabetes. And then lo and behold, now these guys have a bunch of medications for diabetes.
Yeah, isn't that funny?
By destroying people's dietary, destroying people's dietary habits, you just are profiting handsomely off of destroying people's dietary habits.
Yeah. Or the other one that has come up lately is, Bayer, German-based, pharmaceutical company, has a cure for or a drug for lymphoma. Monsanto is the one that is spreading glyphosate all over these, plants and stuff that we eat every day. Which is the primary cause of lymphoma. Well, guess what? Two companies just merged, Bayer and Monsanto.
Well, yeah,
that's you got a recurring revenue stream.
That's
unbelievable.
That's 5+ year old news though. That's been happening.
No, for sure. I mean, but it's those types of things that happen all the time.
Yeah. Here's another fun fact about Bayer: is that Bayer used to be called IG Farben, and IG Farben was a Nazi company that made the Zyklon B for the gas chambers in Germany.
Sure, yeah.
And then those guys are now giving you public health advice. You're taking health advice from actual Nazis. And then you're called a Nazi for questioning
Yeah.
the Nazis giving you public health advice.
Let's be clear before you get sued or me get sued. It's not actual Nazis over there right now. It is founded within Nazi Germany by the Nazis, right?
Yes. These are not actual Nazis.
Okay.
Yeah. Just
make
for
sure.
clarification.
I got a company to run, dude. I can't be.
Okay, right. Sure. It's just a big generalization, right? And yes, you could see that there's a lot of problems within the healthcare industry and with the regulatory capture and all that stuff. But how does crowd health circumvent that?
Yeah, I mean, again, it takes out all those middlemen, right? It takes out all those middlemen. Even most importantly, you're making decision for your own health care, right? I was talking to a guy who lives in Canada today. I was on his podcast. His wife had COVID. He went to the ER. They said, "What are you doing here? You shouldn't be here. You need to go home and drink water." And he said, "Well, my wife's got COVID. Clearly something's going on." They then put him in the janitor closet.
Why would they put him in the janitor's closet?
Because they were so afraid of her COVID. So literally stuck her in the janitor's closet. The doctor came in and said, "You have, double pneumonia, but there's nothing we can do of it. Go home." Okay, this is Canada. So they went home, and you cannot pay your doctor directly in Canada. It has to all come from the government. So the government basically dictates exactly what you can or cannot do within the healthcare system. So he called a buddy of his who found an underground pharmacy within Canada that would ship him, the COVID cocktail, ivermectin, and all these things. But he had to do that undercover, illegally, to get medications. And that's what it looks like when you have a healthcare system that's run by the government, right? We're trying to be the exact opposite of that, which is you buy healthcare the same way you buy everything else, in cash. You decide what you want, what you don't want to pay, but you pay it in cash at the point of care from the person who is, delivering care for you directly to them. I mean, it totally disrupts the entire insurance-based / government-based system. So, when people say, "Oh, Medicare for All is going to be awesome," it's like, okay, do you really want, your health care to be determined by the government? What you can and can't do in healthcare determined by the government? I mean, I don't think so. I don't think that's what we want as a country.
No, I certainly wouldn't want that. What exactly is Medicare for All?
Yeah, Medicare currently is for primarily folks over 65. So once you turn 65, no other health insurance plans will pay for, will cover you, and so Medicare is your only option.
Why won't they cover you?
Because, you get really expensive after 65. We have a country full of people with chronic conditions. Something like 65% of people, 70% of people, I think it was 67% of people have a chronic condition by the time they're 65. And so health insurance plans don't want to cover that, especially since you have the alternative, which is, Medicare. And why would you pay for health insurance if you have Medicare? It's free, from the government, or very low cost. And so you're not going to pay for a $2,000 a month, health insurance plan on top of that. So everybody over the age of 65 has Medicare or is uninsured, one of the two.
Or Medicaid, right?
Well,
what's the difference between Medicare and Medicaid?
Medicaid is for poor, and Medicare is for old.
Okay, so once you turn 65, I could just get Medicare and not have to worry about health insurance?
You don't worry about health insurance after 65.
What is covered
except for all the other, most of the stuff, they don't cover drugs unless you get, there's A, B, C, D, I think it goes all the way to G. You get A and B as a part of just being a Medicare payer into the system. Everybody pays for Medicare currently if you are employed. A part of your paycheck goes directly to Medicare.
Oh, so it's not really free healthcare. You're just getting robbed at your job.
You're getting robbed now. It's like
that
Social Security, right?
Okay.
Like if you're old and poor, you have Medicare and Medicaid, which covers just a lot more stuff. So it's basically what your health insurance plan would pay for if you were under 65. That's what Medicare A and B pay for. And then you have to pay up to get to Medicare Part D, which I believe is the one with the pharmaceuticals. So you have to pay up for that.
That sounds kind of crazy.
It is crazy.
So then Medicaid is just anybody who's poor just gets Medicaid?
You have to apply for it.
What are the qualifications to be on Medicaid?
I think it's like 200% of the federal poverty line. So I think federal poverty line for one person is $19,000 or something like that
a year. Okay.
Yeah, and then two people, it just scales up. beyond that. So if you make under 19 grand, you are. I think
Well,
it's
how are you
there's
not
200%.
So how are you
Medicare,
not
so it's
homeless
38.
if you're making 19 grand a year?
You are probably, and those are most of the people on Medicaid are a lot of either homeless, not a lot of homeowners. You're in apartments.
Well, you're definitely not.
You're
You
in,
definitely can't be a homeowner if you're making 19K a
Right.
year, right? Unless you just have a ton of investment income.
and you get around it.
Yeah, like unless you just have a ton of investment income and decide to get like the stupidest job possible to make under 19K a year just so you can get free health insurance. But then if you're a multimillionaire, why would you do that? Just like go make.
There's
something
an asset test too. There's an asset test.
Oh.
So you have to have us under a certain amount of assets to get it as well.
Okay, all right. Because I was like, wait a minute, wouldn't
Or
imagine if a bunch of billionaires just
or what
just
you
go
can
on
do is you can
Medicaid.
pay your you can sell your assets, but if you sell your assets and you're then on Medicaid, you have to pay Medicaid to get down to the minimum or the maximum asset level. So you can just basically, say, here, Medicaid, here's my, here's all my assets.
You may as well just use Crowd Health then.
You should-
okay,
you
may
should
as well
use Crowd Health.
Okay, that's insane. Okay,
That's the bottom line of this. Just use Crowd Health.
so then how is Medicare for All different from universal health care?
It's not.
It's the same thing, right? And that's what gets confusing because people throw all these terms around like, oh, we want universal health care,
Yeah,
and then we
same
want
thing.
Medicare for all. And I'm like, wait a minute. So I could be wrong on this because I'm not an expert. I ride a tricycle for a living, right? I'm just trying to figure this out. Under the universal health care model, about half of your taxable income just goes to health care or
That's.
something like that.
I mean, your taxes go up significantly.
Yeah, significantly. So like instead of taking out like 30% or 20% in taxes, like you're paying 40%, 50% of tax.
I mean, most of the European countries are up in the 50+% range.
So if 40% of my check is getting taken out for taxes, would I still need to pay for Medicare if universal health care is a reoccurring system that happens until you're dead? Because now all of a sudden you already have what Medicare is.
Yeah, you would be taken out of your taxes or out of your paycheck every month, and then you would have
For healthcare and Medicare, or just for healthcare?
It would be That would be one and the same.
The two things would become synonymous, would sync up and be
Exactly.
like one.
Your healthcare would be Medicare, which
Okay.
is a government-run
Healthcare.
healthcare system.
Government healthcare system. So I could go to the doctor whenever. We're gonna try to game out the positives and game out the negatives, so
Okay.
people can understand
Rock on.
what this stuff is. Because a lot of people are really confused about it, myself included. There's a lot of bad messaging, especially with the presidential election. People talk about how Donald Trump's going to destroy Obamacare and gut your health care and do all this other stuff, and a lot of people are really scared because it sounds scary.
Yeah.
And a lot of people are poor and can't afford health care, and that sounds scary.
Yep.
And a lot of people,
Rightfully so.
A lot of people are in crippling debt from student loans and from credit cards and from everything else. It's scary.
Yeah.
A lot of people made bad investments. It's scary. A lot of people have $100,000 student. You get where I'm going, right?
Yep.
It's scary. It sounds scary, right? So it's good to like kind of deconstruct this and figure out like what all this stuff really means, right? And so I'm just gonna kind of game this out one by one and just
Yeah.
coach me through what I'm right about and what I'm wrong about.
Yep.
All right. So we're under a universal healthcare model, and 40% of my check gets taken out for healthcare, and that's no matter what your salary is, or is it like if you earn over a certain amount of money?
It would determine how they set up the universal system. So I don't know if it would be, it would be at least another 10 to 15% incremental out of your paycheck would go for healthcare.
Okay, which cool. If you're making $40K a year and you have free healthcare and only like 20% of your earnings go to that, I could see somebody who makes $40K a year being like,
all in.
Yeah, because it helps them.
Yeah.
If you're a millionaire.
Yep. If you're making, $300,000 a year.
Yeah. Or if you're making $300,000 a year,
then you're out probably, an extra $1,500 a month.
Right. So you're out. No, probably
way more than that if you're a Crowd Health member.
You're probably paying over $100,000 a year in taxes now. Easily, just from that.
I'm just saying, if it's another 10 or 15% on top of your taxes, so incremental, you're paying another $30,000 or $45,000. So let's say $3,000 or $4,000 a month. And Crowd Health for an individual is $135 a month, or excuse me, $185 a month, and so $3,800 times 12. Let's just say it's $45,000 extra you would be paying per year for healthcare,
which is absurd.
Which is absurd because
if you're in the $100,000 range. You own a home. Chances are you got a family. You got kids. You want to make. That's not a lot of money when you have the expenses that come with having a family.
Yeah,
right.
Exactly.
You kind of wind up in a similar boat. You just live in a nicer area, and your kids go to better schools. You got to pay for your kid to go to college. You got to do all this stuff, right? and you also have to have money aside in case an emergency happens, and you have your investments, you have a lot. There are a lot of things that you need to worry about, right? Especially with the cost of goods and services going up through inflation. You add that tax for healthcare, a guy in that range is not going to be happy with that.
No.
They're going to be pissed. They're going to not want to work as hard, right? They're going to be more willing to circumvent the system, and they may even decide to flee and go somewhere else where these conditions are not as oppressive. And so then all of a sudden now the U.S. government has a lot less income to even extract from. When you have less income to extract from, these services like healthcare become harder to attain and of a much lower quality. I'm
on board with all of that.
Yeah. So that's what the concern could be. And then not to mention, if you're a billionaire and you have a company and you have to deal with all that stuff, then you're going to fire a bunch of people, and then you have an economic recession, and then people are going to have less taxable income to even be able to afford all this. And then all of a sudden now you have these long-ass wait lines to go to the doctor. And I know it's a problem in Europe with, like, emergency surgeries. You got to wait months and months and months and then for, like, emergency surgeries and procedures.
Same thing in Canada, which has universal
Canada
healthcare.
and Europe is pretty much the same thing. They're the same World Economic Forum model.
Yeah, exactly.
Right? Yeah, Klaus Schwab has equal control in both of those areas, right?
So the way I think look at it is like, look, there's three things you control: quality, speed, cost.
Okay.
You can get 2 out of 3. Which 2 do you want?
Wait, quality and speed.
Quality, speed, cost.
Quality and speed.
Quality and speed.
Yeah.
That's the way that the United States has decided it.
Yeah.
So we have higher cost, but we have high quality and high speed.
Yes, and then crowd health circumvents the cost because people can opt out, and then
exactly.
Yeah.
And so we're doing the long leg of that stool, right? Is we're taking the cost and we're bringing the cost down. So you can have the same speed, the same quality, and a lower cost by doing crowd health.
Yeah.
Right, so those are things, and so what Canada has decided to do is they have decided to focus on cost. So their cost of healthcare is less, but the quality is significantly less. Right, so they miss on quality, and even speed sucks because during COVID especially, it was taking you 9 to 12 months to get to a orthopedic surgeon to fix your knee. We have people calling us all the time from Canada being like, hey, can I get on crowd health? And we're like, why? We're like, because I have to wait 6 months to get my ACL tear
But would the doctor
repaired.
even see you unless you're, like, if you want to use a private company because of how bureaucratized it is?
A company in Canada, somebody in Canada would have to fly to the United States, and that's what they're asking is, can we fly to the United States to get an orthopedic surgeon in the United States because we can do it immediately?
That doesn't seem very progressive or
as
equitable.
opposed to waiting 6 months to get my ACL repaired. So we have people traveling to the United States because it's taking so long in their home country to get their medical care.
Okay, that's wild.
Yeah.
That never gets talked about in the news.
No.
And also the Republican.
We're seeing it real hands
Also,
all the time.
Donald Trump and the people in the GOP don't ever talk about that at all, and they literally make themselves look like the bad guys and the villains when it comes to the healthcare debate, and that's exasperating.
Yeah. Oklahoma Surgery Center, I was talking to their CEO, and there's like, yeah, one of the number one places where we get people is from other countries. Like Canada is the big one.
Okay.
Because
That's
it's
insane.
Oklahoma Surgery Center is known to be a low cost, high quality provider, and so these guys fly into Oklahoma City, get their whatever done, and then fly home.
So, okay, have you made any connections with people in the Texas legislature?
Yeah, some.
Who have you talked to?
Well, less legislature and more on the AG side and things like that.
Like Paxton?
Not Paxton, but some of his subordinates.
Okay. How has that gone?
It's going great.
What have y'all talked about?
Look, I think that the number one issue that we have is a regulatory issue because regulators don't like what we're doing.
Yeah, no shit.
Yeah. And so, we get regulators calling us all the time being like, you're in the practice of insurance. And so we have gone through several states now. I won't mention them publicly, but we've gone through several states. They've done a 6 to 9 month proctology exam on our business model, and they have all come out on the other side saying, yeah, you're not health insurance. So we try to have conversations with all of the
It's not health insurance, right?
It's not health insurance.
It's it's health.
It's crowdfunding. It's crowdfunding.
It's health
your
sharing, yeah.
Crowdfunding your healthcare needs.
Yeah.
And so we try to get in touch with a lot of these enforcement agencies to say, hey, listen, here's what we're doing. We're just being open with you. And, the feedback has been like, man, that's super innovative. Are you saving our members money, our constituents money? Yeah, we're saving them a ton of money. I saved $20,000 last year using Crowd Health. Most of our families are saving somewhere around $7,000 to $10,000.
Okay.
And are the bills getting paid? Yes, the bills are getting paid. They're like, man,
yeah, because
awesome.
you have a really good balance sheet.
Yeah.
Your balance sheet's probably better than a lot of the corporate healthcare providers. If
We're profitable. Last month was our first month of profitability. We're a startup, right? So getting to profitability is like the big
yeah.
thing.
When did you guys start? 2019 or
21? April of 21.
Oh yeah, well that makes sense because you started at the top of the bull market, and yeah, okay, that this makes sense.
Yeah,
that makes sense. So you guys were probably needed a lot of capital to even get this thing off the ground, especially with how bad 2022 was.
A decent amount of capital.
Were you guys worried about going under in 22?
No, because we had plenty of capital. We were growing really fast.
You know why I'm asking, right?
Why is that?
Because of how low the Bitcoin price went and how bad the market was and all that other stuff.
Oh yeah. No. We were fine. We were totally fine in 22, and we're fine now because we have plenty of money in the bank and we're profitable, and so we're good to go now. We're off to the races.
Okay. And you guys have Bitcoin on the balance sheet and all that other stuff too.
Yeah, a little bit of Bitcoin on the balance sheet. We've got about a third of our members are Bitcoin members. We're going to be allowing them to save in Bitcoin here shortly.
Well, yeah, because I wanted to do that through Swan, and I'm still not even able to do that in Texas.
I know it sucks. Because
why can't we use another? Why can't we just use another wallet and not use Swan?
We're going to. Stay tuned. You'll hear from us in about
use
2
Unchained.
weeks. Well, they can't do it.
Why?
They can't do it at the scale that we want to do it.
Oh, really?
Yeah.
Okay.
Yeah. So there's another provider out there that everybody knows that we're working with.
And there's another cool thing about Crowd Health too, and is that you can take your money out at any time.
Yeah. I mean, you can leave at any time. The other thing with insurance, if you sign up for your corporate insurance in the next couple of months, you cannot leave that insurance. You cannot stop paying that insurance company until next year.
Okay. Yeah.
So it's pretty ridiculous.
My girlfriend has a job at Anna. It's a great company. You've heard of Anna, right?
Yeah.
The health, yeah. And she gets insurance through her job.
Okay.
And I've told her, I'm like, well, if we're going to try to get pregnant, you should probably, it might not be a bad idea to just join Crowd Health and get off your corporate insurance. Because, A, it'll be a lot cheaper to have a baby. B, the doctors are not going to recommend as many crazy, horrible things to you when you're pregnant. And C, the shots that they're going to try to have the baby take, they're not going to do that when you're paying cash.
Exactly.
Or
You have a lot more sovereignty over what you can and can't do.
And you're going to actually pay less out of pocket. You're only going to pay like $500, and then everybody else is going to just cover your pregnancy. Especially a procedure like pregnancy, no one's skimping out on helping a pregnant lady give birth. Especially in this community, that's not going to happen.
Oh, no. Our number one funding request is pregnancy.
Pregnancy.
Number 2 is injury.
Yeah.
And because people, it's like mountain bike face plants and stuff like that.
Yeah, because you actually get healthy people who do Crowd Health, which is
our average age is under 34. The body mass index is like 4 or 5 points lower than the national average. We got a bunch of healthy people, and for us, it's like, look, who do you want to subsidize? Who do you want to help? Do you want to help the guys who are working out and out in their mountain bikes and being active and things like that, or do you want to work help pay for people who have diabetes as a lifestyle issue? Now you're paying for all kinds of crazy stuff within health insurance. You're doing gender transitions, you're doing GLP-1s, you're doing all kinds of crazy stuff with health insurance now. So as the government is forcing these health insurance companies to pay for more and more stuff,
dude,
you're not paying for that stuff.
Yeah. And then with this whole universal healthcare model, first of all, it puts Crowd Health out of business. Potentially.
Yeah, well, it could.
Right? Like universal healthcare will put Crowd Health out of business.
It would probably what we if somebody came and did universal healthcare, what we would do is I say, look, there's a bunch of stuff that this universal healthcare doesn't pay for. Will be a layer on top of it. It'll be a lot less expensive for you because it's just the top layer.
Yeah.
We would still be around, but it would be a pain. It would suck.
Yeah, it would suck.
Yeah, it would suck.
It would suck. What was I gonna say? But yeah, could you imagine, like, paying 40% of your income, and a portion of that money has to go to gender reassignment surgery for children, regardless of whether you want to do that or not? Like, that's, I don't understand how people aren't like just disgusted by that, right? Like how people aren't like shaking their head and like totally mind boggled by the fact that that this absurdity is an actual reality.
It's a reality, and health insurance companies are paying for it, which means that you're paying for it.
Yeah, because either you're paying it out of pocket through corporate healthcare, you're paying through the marketplace with Obamacare, or you're getting taxed out the ass to pay for things that are just ridiculous and absurd. And the more of these things that they cover, the more money that has to get taken out of your taxes to pay for things that aren't even necessary. And then when you're subsidizing things like that, guess what? You're not subsidizing things that are productive and actually advance society.
Amen.
Yeah, it's.
We need you as our sales guy.
Dude, I'm happy to take a second. Look, these trips are not cheap, Andy. So
Yeah, exactly.
anything to help fund the field trips. I'm happy to help. I'm happy to do.
I love it.
Yeah,
I
anything
love
to
it.
help fund these field trips is something I'm actually really happy with. What was I gonna say? Okay, so what are the disqualifications to be a crowd health member?
Smokers.
Can't smoke cigarettes
You can't smoke cigarettes.
at all. Like you can't.
I mean, not a daily occurrence. It can't
Like,
be every day for a year.
If somebody were to have a drunk cigarette, are they allowed to be on crowd?
Yes, for sure.
Okay.
Yeah, for sure. I smoke cigars once in a while. It's fine.
Okay.
You know, I don't do cigarettes. I do cigars.
Cigarettes are gross.
Yeah, I mean, I think they are. Yeah, and then if you are over 240,
What if you're like 6'7" and 240?
that we make exceptions.
Okay. Like
Yeah,
what if you're 240 and like visibly healthy, but you're just big? Or what if you're like an offensive lineman?
Yeah, I mean, we make exceptions. If you're really, really tall, we'll make exceptions.
Okay.
If you're 6'2" like me and you're 240, we're not gonna make an exception unless you're absolutely jacked.
Or you're just an athlete. Like what? Like because I know this is like an outlier, right?
Yeah, totally.
We're playing with outliers, but like I do know some very fat people who are very in shape. Like there are people I've trained MMA with who do not look like they're in shape and just look like total dumpy blobs, and they'll just fuck you up. You know what I mean? And it's not because of, like, and yeah, they're more technical, obviously, but like they don't get tired.
Yeah.
Like there have been some fat guys that I've like rolled with, like titties and everything. They don't get they don't get tired.
Yeah.
You know, like there are still some exceptions. There's some like
Sure.
there are people that could be qualified as obese and they're doing full splits and they're just phenomenal athletes. Like
Sure.
how do those people like? Would there be an exception for those people? And how would you be able to prove? Like, how would you be able to
We
circumvent?
probably wouldn't.
You wouldn't be able to,
I
right?
mean, yeah, all those little kind of fringe cases. It's hard for us to do. I mean, if you're obviously jacked, then we will make an exception. But it's hard for us for the fat guy who can do taekwondo or whatever you said, jujitsu, to make exceptions for those guys. I mean, I think that there's probably an avenue here. Like, look, your waist size is just a proxy
Yeah.
for you being out of shape.
Like, my view, right, is like if that is the case, and you're like a professional boxer or something like that, I'm like, oh, here,
Yeah.
let's submit a video of your like last fight or something like that. And then we'll tell then we can.
I could be
figure- yeah.
convinced. I could be
Yeah,
convinced.
yeah, like-
but in reality, like it's the visceral fat level that really is the problem, which means the fat that hangs out around your organs. That's what causes chronic disease, not the fat that sits that you can actually see. This is just a proxy for what's inside.
What's inside? Okay.
And so there are cases that you could look very fat on the outside, but really
no fat in the organs,
but
you're
no
just healthy,
no
yeah.
fat on the organs. And alternatively, which is a problem, is you can look skinny, but you actually have it's actually called like skinny fat.
Skinny fat. I know what you're talking about. Yeah.
Yeah, skinny fat. And so you actually have a lot of fat hanging out around your organs. Yeah. So the way that you can tell is you go get a DEXA scan. They're like $75. And the DEXA scan basically takes a scan of your body and it will tell you how much visceral fat that you have.
Being skinny fat is the worst body type.
I mean, arguably, yes.
Yeah.
Well, because you think you're healthy and you're not. Right?
Well, no, I think it's very obvious. Anyone who's skinny fat is obviously very unhealthy, Andy.
Okay.
Like, when you think about it, like when you have like really thin arms with no muscle tone and a big protruding gut, it's not a healthy body type.
That sounds fat to me, a big protruding gut.
But that's skinny fat, though, because you have like a skinny body but a fat tummy. Like, that's being skinny fat.
Yeah. There are
That's my
actually people
definition
that
of it.
look skinny but actually have a ton of fat hanging out around the organs. It's just not hanging out outside of
You
the
just see it
muscle.
inside, yeah.
It's all inside.
Which is
so there's
crazy.
actually people who look skinny, don't have protruding guts, that have all kinds of fat
But
hanging
then
out inside.
somebody like that could also be under 240.
Could be. And,
Would they qualify?
they would qualify the way that we currently have it. I mean, one of the things when you start a company and run a company, you can't get everything perfect.
You can't get everything
there's
perfect. There's
outliers
always gonna be
that just
outliers.
like, well,
Sorry, I'm asking a lot of questions, but I'm just
no, it's good.
It's
good.
a-
And in reality, what we should have everybody do, or give everybody, a discount, is if they can show us that their visceral fat levels are really, really low. And in fact, we actually have a new crowd called the carnivore crowd. So people who eat low carb, it's not necessarily just carnivore, it's low carb. You have to go and take a test that shows you either have a fasting insulin level below 5 or visceral fat at the lower 25%. So we actually make you take that test before you can join the community.
That's cool. That's
Yeah.
actually pretty cool. That is really cool. What are the other disqualifying factors?
That's it.
So just don't be
All
fat.
50 states.
Don't be a type 2
Don't
diabetic.
smoke.
Don't be
Yeah, don't smoke. Don't be
Don't be a fat
overweight.
pig and then
and the other thing is too is we only do U.S.
okay.
So there's
Yeah.
no international at this point.
Yeah, well that makes sense.
Yeah. So if you're an
Um,
expat, we can do expat, so you can live
Okay.
international.
So how do we bring the private doctors back? That was what we started talking about, and we got super sidetracked.
Oh, okay.
On stuff that's really good, right? But like, I want to know, like, how do you bring back the private doctors?
Yeah, because the private doctors right now are getting
Fucked.
hammered by health insurance companies. And given they're getting hammered, these big hospital systems are going to them and say, hey, well, why don't we just buy you? You can be part of the hospital system. You don't have to worry about running these businesses anymore. We can get better rates because the hospital system is negotiating with the health plan as opposed to the individual doctor. And so it's, it looks like a win-win-win. Look, this is just a pendulum. It goes back and forth all the time. 10 years ago, it was very heavily weighted towards the independent doctor. Now it's heavily weighted towards the employed hospital system doctor. The pendulum will swing backwards. It's already starting to do that over the last couple of years. What we're starting to see is doctors who will only accept cash starting to pop up in a fairly
like no
big
credit
way.
Cards, actual physical, just
No, well, credit card or cash. They will not take insurance. So we're
that's
seeing
cool.
more and more doctors who
But then
won't
how do they pay
take
the
insurance.
overhead though? Like
Enough private pay cash payers or enough cash payers are popping up that allow these people to they're the better doctors too.
Okay.
Because what kind of doctor would go and do that? A really good doctor, knowing that people will actually pay to get your service.
That makes sense. Or Bitcoin and stuff. Yeah, and
right.
That levels the playing field. But then what about like for surgeries and for things like that? Like because that like once being a family doctor is fine, but then when you have to do like actual complex operations, that's when it really becomes.
Yeah, these surgery centers are popping up outside the hospital, so it's way less expensive to go to a surgery center than a hospital because hospitals are so expensive. And so the free market is working in some of this. So surgery centers are popping up all over the place. These doctors now can do their surgeries. Mostly of these are outpatient. There are some inpatient. It's harder for heart surgeries and things like that are inpatient.
I think you got to lobby that in the small towns. I think that's a big business, right? And like you don't want to price because like I moved to small towns out of Austin. Last thing I want to do is turn the place I moved to into the place I moved from.
Yeah. Totally.
But if there's a way to economically build up the town where people who live there benefit from it, it would seem feasible that private surgery centers and private doctors' offices would be a really good way to build the town out.
Yeah, probably. And in the meantime, you're willing to come into Austin to work. Right, so you might just have to come into Austin or wherever to do some of these.
I'm
things
fine. I listen to so many
out.
podcasts, and I've gotten a lot smarter as a result of it. I love the idea of people ask me like how I deal with it and this and that. I actually enjoy it tremendously because I drink a coffee, put on a podcast, listen to things, get a lot smarter, become a lot more aware of what's going on.
Yeah.
I think my aptitude and intelligence and nuance, like I've gotten a much more like apt and nuanced view of the world around me as a result of having to travel an hour.
Yeah.
Because I have no choice. I have to listen to something for I have to get smarter or I just become angry.
And if you could save, $5,000 or $7,000 by coming down to Austin, traveling that hour to come to Austin, you would do that.
Yeah, well, absolutely. But
you wouldn't if you were on health insurance because somebody else is paying that bill.
Yeah. Well, also
so it's like bring the free market back to healthcare, right?
Also, the idea of a private hospital, and I'm bringing this up because I'm like friends with the mayor. It's fun. It's kind of weird because the people in Austin hate, like the city officials hate me, but the mayor where I live actually is like the mayor of my town is actually a fan of my stuff.
Hilarious.
Which is great. Like she comments on my feed, and I like.
That's awesome.
Yeah, she shares my videos with her staff members, so it's like it's actually a different world. It's like you're a respected business owner in the community where I live, whereas here I'm a fucking asshole. Like I'm a
People don't realize like you don't have to get too far outside of Austin for the
world
the
to
climate to change. Yeah. I mean it's pretty quick.
It depending, all right. Like if you go to San Marcos, it's just as woke as it is in Austin.
It depends which.
Actually, no, San Marcos isn't that bad, but
it's not that bad.
And Austin's not even that woke either. When you talk to most people in Austin, they do not act in the same way that the government governs here.
Exactly.
Because I play my rap songs and tell people we're fighting communism and do all this other stuff, and it gets very well received mostly.
Yeah.
So I think.
But yet people in Austin continue to elect these crazies.
Yeah, because our GOP is a fucking disaster, and the only one side knows how to communicate at scale, and the other side does not. And then the people who actually are agreeing with me and you on things are not politically involved. Like, do you know who your city council members are?
I have no idea.
There you go.
I'm actually outside of Austin, so.
Where are you at?
I'm in Travis County.
Like Lake Travis or Lake Williams?
I'm in Westwood. Between Rollingwood and Westlake.
Okay.
So we're not in city limits.
Sure, but like how many people that go to the
How many people that go to
the Bitcoin Commons meetings that live in Austin even know who their city council members are?
Probably not.
Yeah. Whose fault is that?
They're probably theirs.
I mean, no. no, we're not doing that. It's not their fault. It's bad communication. It's the GOP's fault. It's the people it's the city officials. It's the political activists in Austin who are upset and frustrated and furious about what's happening here that are not getting their message out. It's their fault.
Yeah,
because they should know. People know who I am. You know. It's
third
not because
party.
they.
What about a third party?
Yeah. So I don't know. That's my viewpoint on that. Right?
I'd vote for you, third party.
I appreciate that, but getting sidetracked a little bit, getting a little sidetracked on that.
It's really hot out here, by the way.
It's fucking hot, dude. It's crazy. I can't wait to go to my air conditioned car and drive to New Braunfels for my speech at the Red Stiletto Women's Republican Club.
It should be
you
interesting. I have something to do
you have
tonight,
something to do. Yeah,
but I take pictures and post them.
I got to see if my videographer can videotape. But yes, I would. That's obviously going to be the plan. It'll be a lot of fun. I'm excited. But yeah, I think there's something to be done about private, like getting surgery centers in small towns.
Yeah.
Because you know what that'll do too? It gets people to come. It'll get people to come here, right? You're not going to need to build a bunch of apartments because they can afford to buy actual houses. A lot of older people, or people that a lot of people could be falling behind on their mortgages and falling behind in a lot of things. They get bailed out. Right, because some like these doctors and people whatnot will be able to afford to take a lot of the financial burden off these people. The restaurants, the small businesses get a ton of money because these people get to go to the bars, they go to the restaurants.
The question is
the
volume there? Is the volume there to support it?
I think so.
That's ultimately the question.
Yeah, I
or
think so.
Can you get people to fly in or drive in?
I think it's not impossible to have like a surgery center. I think that's a good thing. I think it generates money for the town. There's more taxable revenue without having to raise property taxes because people can afford to just pay. There'll just be more people that you can tax, and then you can actually build things out, like improve the roads and do all these other things that should be done.
Well, it goes back to like if you can increase the population of people who pay in cash, then you can have a lot more of that market-based system that says, hey, if you wanted to pay less, you go out to whatever your small town is, and there's a surgery center out there, and they'll do it for $4,000 or $5,000 less than you can do it in downtown Austin. Then you'll make that decision to go and do that because we would both go and do that.
I would do it, yeah, and I'd live in that area, so yeah, it's a no-brainer. And then,
but insurance companies, you're not actually the one paying for it. The insurance company is paying for
exactly.
it, right? And so you're not going to go out to wherever you live.
Fuck no, makes no sense.
Yeah.
That makes absolutely no sense. But yeah, by doing that, like you're getting you're providing revenue for your small town. You're providing revenue for your small town. You're helping the small business community grow. You're bringing people in who have American values, and you're boosting the economy in a way that you don't need to like get a bunch of illegal immigrants to get dropped off in your town to replace the people who live here.
Yeah. Well, how the hospital systems are battling this is that there are laws called certificate of need laws. They're called con laws. I think it's an appropriate name. And basically what it is that you have to get approval from the legislature to get to build a new medical facility in that specific state. So there's like 36 states that have con laws.
Does Texas have one?
And I believe Texas has one.
They got to get rid of that shit.
They got to get rid of it. I mean, it is the most anti-free market,
it
thing ever.
People to be dependent on the healthcare system.
Yeah, and it forces or it allows these big hospital systems
to exploit it.
Exploit it.
So
if somebody thinks that they can make money in your small town doing a surgery center, they should be allowed to use their own money to build a surgery center. If it doesn't work out, it doesn't work out. If it works out, then great. But right now, in 36 states, I believe it's 36, you can't do that without approval from, the bureaucracy of your state government.
I'm gonna post that on my social media, and I'm gonna send that clip because I actually got like some friends in the legislature, like and little white pill, the governing body of the Texas House and Senate is going to be a lot more conservative than it was last year. And
why is that?
Because a lot of, and I'm talking about like the right kind of conservatism, like the freedom, like true free market, non-bureaucratic, non-rhino type of conservatism. Because these people, a lot of them won their primaries. The school choice thing was such a problem that there were a lot of these like fake corporate Republicans that voted against school choice because they were paid off by all these teachers unions. They got primaried out, and so now you have a whole new group of Republicans that like could actually be receptive to this stuff. Like there's like I could count. I'm not tooting my horn, but there's probably like 5 or 6 representatives that like are fans of my videos that I can call and send a text message to and send a video to and be like, hey, can we fix this?
Yeah, you should.
You know what
Those
I mean?
laws
like there's actually like if you ever want to go to the legislature with me or something like that. We can go together because the next legislative session is like in January.
Yeah,
like
January.
if you want to actually go and do this, I mean, we could actually, you might actually be able to go talk to these people and say, hey, why aren't we fixing this? Like, after this speech at this Republican club, like I'll bring your name up. Like I'll start shouting your name out, especially like when I get invited to do more speeches and more events. I'll suggest, people like you becoming guest speakers. I think there are a lot of problems and a lot of like average boomer GOP voters, because that's who goes to most of these things.
Yeah.
Kind of recognize but have no clue as to how to solve. And I think that more people like us need to be there. Like more people like us need to be around to kind of help people solve the problems. Because if you don't solve the problem that you're upset about, then these bureaucrats and these globalists and these people that want to fulfill the 2030 agenda, they're going to be the ones who solve those problems for you. And you don't want that.
You have whiners or creators. Stop whining about it and go create something. Go do something about it, right?
Yeah. And that's the actual Republican ethos, and we got to actually live to that.
Love it.
All right, Andy, how do we get a hold of you?
JoinCrowdHealth.com.
Okay.
Join Crowd Health on our on Twitter and social media, or X and social media. I'm still on the Twitter.
Okay.
On all the social media platforms.
And your endpoint, and you have a Nostr too, right?
You have Nostr too.
Yes, I have that as well.
Yeah. Yep. So go find us. We are not quite as sassy as you, but we're
well. You shouldn't be. You run a respectable company that helps people fulfill their healthcare needs that are not provided by
I
the
would say we're more fun than your typical healthure company on our social media.
I hope you weren't like me. I would probably not want to use you if you communicated the way that I communicated.
Well, we still need you to do a video for us at some point.
Let me know, because I did make a video for you, but it was,
You got kicked out of the hospital cafeteria?
Yeah.
He did a video for us where he was asking doctors whether or not he would feed They would feed their own patients
the
stuff
hospital
they
food,
were eating in hospitals, and they all kind of looked at him and stared and was like, should you be here? And finally you got kicked out.
And the cop got really mad at me and got aggressive, and I was like, why are you getting mad at me? I just want to know if you want to eat the hospital food.
Yeah, exactly. Exactly. It was awesome.
Yeah. But you guys didn't use it.
Well, it was a little maybe too sassy for us.
All right.
We need to figure out something in between.
Well, the last one where I put that fat suit on and say that I should be that you should subsidize my health care.
That one would be hilarious.
Yeah. You need to subsidize.
You did do that one, or
no?
You
We should. We should actually.
That would be hilarious.
I should probably do it soon.
November, December, January is when everybody's making their healthcare decisions. So
it would be great. Why don't we come up with a video in the next couple weeks, because that's a great time to release it is right by then, and it's only going to be super hot for a small period of time.
Yeah.
And so Barton Springs, talking to a bunch of jack dudes at Barton Springs could actually.
That'd be hilarious.
Yeah.
Love it. Thanks for having me, man.
All right, Andy, always a pleasure.
Yeah, for sure.